deposited in the oropharynx. So if a child is going to receive irrationally high dosages of inhaled medication, that child is bound to develop systemic side effects of long-term steroids, systemic side effects of SABAs and LAMAs. So do not think that inhaled medication can be given in any irrational dosages. The dosages that have been recommended by the international guidelines when it comes to low, medium, and high dosages of inhaled corticosteroids, we must conform to them. There is a reason why this dosage category has been given. So it's important to note the pharmacokinetics of inhaled medication. There are various factors that affect the drug delivery. Uh, Firstly, the particle size of the inhaled medication, the formulation in which it is present, whether it is a suspension in the pressurized metered-dose inhaler, whether it's a solution, whether it's a suspension, what gases are there in the inhaler, whether it's a, of course, nowadays we don't use CFC, chlorofluorocarbons, hydrofluoroalkanes, HFAs are the ones that are used as propellant gases in all pressurized metered-dose inhalers. Uh, we need to know there are some patient factors that affect the drug delivery. It is the compliance, so the technique, the adherence, also the severity of the disease, the pattern of breathing, all these factors affect the drug delivery. Lung deposition is affected by the disease-induced changes. If there is a very narrow airway, then the amount of drug reaching the distal airways may be reduced. And then there are interpatient variation depending upon the patient's metabolizing the drug in the body. So there are some patients who just develop some idiosyncratic reactions to short-acting beta-2 agonists as well. So there are a lot of factors that affect the drug delivery. Uh, we will first discuss the particle size. So when it comes to the particle size, the larger particles, 20 micrograms or so, are mainly deposited in the oropharynx at the back of the throat when we are using a pressurized metered-dose inhaler. About 10 microgram size would be deposited in the larger airways, in the upper airways. 2 to 5 micrograms is the ideal size which reaches the small and medium sized airways, or rather the medium sized airways, and that is responsible for the clinical effect. And less than 0.5 micrograms, they remain in the alveoli. They are either absorbed in the blood vessel or they are exhaled out. But there is another particle size 0.5 to 1.5 micrograms. Okay, so until recently we used to believe that this is the particle size that is ideal for clinical effect, but newer advances have found that the particle size from 0.5 to 1 micron